So when Ryan was diagnosed, we were told that Ryan would not live past the age of 10 or 12. The game of baseball, which he loved so dearly, he would no longer be able to play because his hands would be so stiff he wouldn't be able to hold a bat or a ball. Dr. Lou Weber, the geneticist at Dallas Children's Hospital, explained that because Ryan's disease was so rare, there were no treatments. There would be no cure. There is no business model for a company to develop a drug for an ultra-orphan disorder like Ryan's. The reality was Ryan would come and be with us for a while, then he would die. We would have to wait until we found Dr. Kakis, who developed enzyme replacement therapy. Since 1998, February 13th, our son has endured a 4.5-hour IV infusion. He could not be happier with his treatment because he now, as an adult, sees that treatment gave him opportunity to continue dreaming. So each week, the IV puts back in his system when he can't make himself. He presses on, and his life will be whatever he might want it to be. Rare disease is lonely, but with the EverLife Foundation, we found other voices, other parents, other patients, and together, we truly are making a difference.
The EverLife Foundation for Rare Diseases is a patient advocacy coalition that advocates for evidence-based public policy and regulatory reform in rare diseases. And specifically, we focus on diagnostics and newborn screening, infrastructure for therapeutic development and regulatory reform, and very importantly, access to approved therapies.
EverLife's mission to me as a parent, as a person watching our son grow to be a man now, realizes the most important thing to all of us is time. EverLife knows the science behind these therapies, but they know mostly the policy and what can move treatments faster through the system of 12 to 15 years.
We have pipelines filled with promising, life-altering, innovative therapies. And notably, these therapies include significant innovations in cell and gene therapies. But they will only be effective if they are accessible to the patients for whom they were intended. And our pipelines are robust. And so the reason the EverLife Foundation has band together with our patient advocacy organization partners, our biopharmaceutical industry partners, our federal agency partners, academics and researchers, is so that we can ensure that the promise in the pipelines are fulfilled for the patient communities and the generations living with rare diseases today.
I think one of the most important and often overlooked aspects of rare disease is the great value in advocating for rare disease. We know so many millions of people in the United States suffer from rare disease every single day. We oftentimes don't understand their disorder. We don't understand their journey. The only ones that do are the ones that are on it. We're often very, very lonely because we think we're there by ourselves. And frankly, we're not. I remember the first time I went to Washington, D.C. and saw other patients, other parents, other families advocating for their child. I know personally from laying on the floor next to my son's bed, there was no hope at that moment. There was hope when we found other patients, other parents, other families, other scientists advocating for the lost and forgotten, those on the rare disease journey. My name is Mark Dant.
My name is Annie Kennedy, and I am Bio.